For mothers who have previously undergone breast surgery, there are a number of complications that may require correction after having babies. Number 1, capsular contracture or hardening of the breast. This is when the breast forms a thick internal scar tissue around the implant, causing the breast to become hard, distorted, and change shape. Often, the implant will sit up high on the chest. Number 2 is sagging of the breast over the implant, otherwise known as the Snoopy effect. This is when the breast tissue continues to stretch and the implant doesn't move, therefore creating an unattractive shape between the breast and the implant. Number 3, bottoming out of the breast and the implant. This is when the upper pole or the top of the breast becomes empty and deflated. Number 4 is asymmetry or change in shape of the breast so that the right and left breasts no longer match. Number 5, rippling or irregularities that are felt along the breast due to a loss of breast volume or thinning out of your breast tissue. And finally, change in size. Either the breasts are now too small or too large for the patient's new lifestyle. So, what can be done? What are the surgical options? It can be as simple as removing and replacing the implants. You may need to add the addition of what's called a capsulectomy, which is removal of the scar tissue around the implants. You may have to take the implant out of one pocket and exchange it into another. Most commonly, this means taking the implant from above the muscle and placing it under the muscle. This is called a conversion. And finally, you may need to add some type of lift, giving the breast a more natural shape. These are the most common options. The right type of corrective breast surgery can be quite difficult to determine and even more challenging to perform. But the most important thing to know is that these issues are correctable as long as you do your research and select a surgeon who is very experienced in corrective breast surgery. No mommy makeover would be complete without correcting any previous surgery that needs a makeover of its own.